Welcome to our audio summary of the research article review of cellular therapies for neurologic diseases in horses and dogs. Introduction. The nervous system is a complex entity, derived during development from a sheet of neural stem cells, NSCs. Despite the presence of a small number of NSCs and glial cells in the central nervous system, CNS, their capacity for repair is extremely limited. For decades, regenerative therapies aimed at augmenting or replacing natural cellular or tissue repair mechanisms have been a significant focus of research. Various cell types and biologics have been investigated, including mesenchymal stromal or stem cells, MSCs, embryonic stem cells, NSCs, neural precursor cells, and induced pluripotent stem cells (IPSCs) and their derivatives. This article reviews the potential use of cellular therapies for treating neurologic diseases in veterinary species, specifically horses and dogs. The review highlights proposed mechanisms of action, indications for use, administration techniques, potential benefits, and safety concerns associated with these therapies. The literature search included studies from PubMed and Web of Science core collection from January 1, 2000 to January 1, 2023. Focusing on cellular therapies and neurological diseases without initial restriction to veterinary species. Potential benefits of cellular therapies. Cellular therapies may offer benefits through three primary mechanisms: cellular replacement, immune modulation, and paracrine signaling. Cellular replacement. Administered cells replace original neural cells, potentially restoring lost functions. Immune modulation. Cells may modulate immune responses through direct cell-to-cell contact or secretion of molecules such as cytokines, e.g., IL-10 and TGF Greek letter beta, and enzymes e.g., indolamine 2,3-dioxygenase and arginase. Paracrine signaling. Release of neurotrophic factors like brain-derived neurotrophic factor, BDNF, nerve growth factor NGF and glial-derived neurotrophic factor, GDNF, which promote neuronal survival and repair. The field of cellular therapy has advanced significantly, with notable achievements in liver tissue repair, cardiac tissues, and various nervous system components, including cortical projection neurons, dopaminergic neurons, and cortical motor neurons. However, the technology to generate equine and canine organs has not yet been developed. Most studies in equine models have focused on the immunomodulatory functions of MSCs, demonstrating their anti-inflammatory effects when co-cultured with stimulated lymphocytes. Treatment of neurologic disease with MSCs. Most research using equine or canine stem cells has employed MSCs derived from bone marrow, adipose, or umbilical tissues. These multipotent cells can develop into multiple cell types and are characterized by their ability to undergo trilineage differentiation into fat, bone, and cartilage. When exposed to specific cytokines, MSCs may adopt a neural cell-like morphology, expressing neural markers such as neuron-specific enolase, NOIN, neurofilament M, and tau proteins. MSCs have been investigated for their potential in treating various neurologic conditions, including spinal cord injury and intervertebral disc disease. Studies have shown that MSCs can be administered intrathecally, IV, intraspinally, and directly into the disc with few adverse reactions. Experimental and clinical studies have suggested that MSCs may improve functional and histological outcomes in animals with spinal cord injuries. Challenges and limitations. Despite promising results, several challenges remain in the use of MSCs for treating neurologic diseases. These include the need for more double-blinded, placebo-controlled clinical trials to confirm efficacy and safety. Additionally, the use of allogeneic non-self stem cells is a topic of ongoing debate. While some studies have shown that allogeneic MSCs can modulate immune responses without causing significant adverse reactions, others have reported immune responses in the development of alloantibodies. Neurotrophic treatments. Neurotrophic factors such as NGF, BDNF, and neurotrophin 3 have shown potential in promoting axonal survival and function. However, limitations exist, such as NGF's tendency to cause nociceptive sprouting and resultant pain, which limits its usefulness for spinal cord injury. BDNF has emerged as a promising neurotrophic factor, but its penetration into the CNS remains problematic. Research continues to explore optimal administration routes and dosages for these factors. Cell replacement with NSCs. NSCs, which can differentiate into neurons, astrocytes, and oligodendrocytes, hold promise for treating spinal cord injuries and neurodegenerative diseases. NSCs have been successfully isolated from various sources, including adult canine cervical spinal cords and fetal canine spinal cords. However, challenges such as the loss of neurogenic capacity with expansion and the increasing production of glial cells limit their clinical application. Embryonic stem cells and neural precursor cells. Embryonic stem cells, being totipotent, can develop into all cell types but face logistical and ethical challenges. Neural precursor cells, such as oligodendrocyte precursor cells and neural crest cells, offer potential for treating diseases affecting the myelin sheath and other complex cellular repairs. However, their isolation and differentiation remain challenging, and more research is needed to confirm their efficacy in veterinary species. Treatment of neurodegenerative disease with MSCs or neural precursor cells. MSCs and NSCs have shown promise in treating neurodegenerative diseases such as amyotrophic lateral sclerosis and Alzheimer's disease in animal models. Canine cognitive dysfunction, which shares many commonalities with Alzheimer's disease, may benefit from cellular therapies. Studies have reported clinical improvements in dogs treated with autologous skin-derived neural precursor cells. Treatment of spinal cord injuries with IPSCs. Induced pluripotent stem cells IPSCs created by manipulating the genome of adult cells, offer an alternative to embryonic stem cells without ethical concerns. IPSCs can differentiate into various cell types, including dopaminergic neurons and motor neurons. However, challenges such as teratogenic risks and labor-intensive generation processes limit their clinical use. Research continues to explore the potential of IPSC-derived cell lines for treating spinal cord injuries and other neurologic conditions. Challenges associated with delivery of cellular therapies. Multiple options exist for the implantation of cellular therapies, including intralesional, intrathecal, scaffold-facilitated, and systemic administration. Each method has its advantages and limitations, and the optimal delivery method may vary depending on the disease and lesion characteristics. Studies have shown that intralesional administration may result in the highest number of persistent grafted cells, but clinical improvement does not always correlate with engraftment. Neurologic diseases where cellular therapy is most likely to be of benefit. Cellular therapies may be most beneficial for acute inflammatory or autoimmune-mediated diseases, where the immunomodulatory properties of MSCs can be leveraged. Single-cell diseases, such as Parkinson's disease, also present attractive targets for regenerative therapies. Autologous cellular therapies may be suitable for slowly progressive diseases, while allogeneic therapies could provide immediate treatment options in acute conditions. Promise and challenges. The future of cellular therapy for neurologic disease in companion animals. The field of cellular therapies for veterinary neurologic conditions holds great promise but remains in its infancy. Extensive research is required to determine the efficacy of these therapies and guide clinicians in selecting optimal treatments. Future studies should focus on larger controlled clinical trials to establish safety and long-term efficacy. Conclusion. This extended summary of the article review of cellular therapies for neurologic diseases in horses and dogs provides a comprehensive overview of the study's goals, methodologies, key findings, and implications. The review highlights the potential benefits and challenges of using cellular therapies for treating neurologic diseases in veterinary species, emphasizing the need for further research to confirm their efficacy and safety. Thank you for listening.